I usually start at the feet, work my way up. You do it however you want, right? But we're thinking of general work, right? We're thinking of stretching, compression, all the different movement, the loading. That's the word we're looking for. Let me look on here and make sure I've got. Okay, so we're also going to think about all of our different body parts that we've gone through, the different muscles that we're working on. It's really hard for me to separate neuromuscular from sports massage, so I might be kind of doing a little bit of both.
Yeah, I was going to ask, is sports massage just kind of like...
It's a huge umbrella term. Yeah, it really is.
I feel like it's almost clothed neuro.
Yeah.
That's the way I differentiate it. Today we're doing clothes, tomorrow we're doing clothes.
Yeah.
With like more movement.
Yeah, there's a little more movement, a little more stretching. I like working through the clothing because I can take and, you know, move and do all sorts of stuff that you couldn't do with, you know, with a sheet. Couldn't do draped. So if we're going to think pre-event sports massage, it's going to be a little more faster pace, right? A little more warm up there. It might be pretty general, just a 10-15 minute routine, working through, moving through everything, you know, just getting the blood flow there.
So when we're doing this in our practical, are you going to put on faster paced music?
But it's only for pre-event.
It's only, yeah, see, I don't know. We'll do whatever we want.
Why not be
on,
able to
because
change the music?
do
So
what?
we can do pre-event for the first
minutes.
10-15 minutes and then
Someone make a playlist.
That's a good idea. Yeah, we can do that. So first 10-15 minutes we'll do pre-event.
Okay.
Yeah,
Okay,
we're
so
all
just-
kind of making a plan as we go here, right?
Yeah,
Let's
no,
do it.
I'm cool with that.
Okay.
I'm glad you're responsive.
So I'm starting down here at the feet. I really don't have a plan. I'm just kind of, which is fine, right? So pretty general work. I'm not finding anything specific for pre-event, right? We're just kind of moving and feeling, getting the blood flowing, just kind of checking everything through here. I like to give some compressions through the feet. Working up, squeezing through the calves. Remember we were talking about, we just did this last week, I think, coming in. I'm not just like compressing. I'm trying to get into those areas that, still thinking of all the muscles through my head, right? Getting these medial muscles here that can be pretty tender. But if it's pre-event, we're not trying to release anything. We're just getting general movement, right? Get a little movement through the kneecaps, which I don't know that we've really done in class. It feels pretty good. Broad compressions. Okay, don't forget we've got stretching that we've done, and at this point I don't remember what we've really done in class, what we haven't. But I'm just trying to think about all the different ways. So I'm on her leg, so how many different ways can her leg move, right? Okay, but it's pretty quick. So that's one leg there, right? We're not really going to do a whole lot of abdominal work. If you wanted to stretch psoas, you could have them come over and hang the leg off the table to get the psoas there. For this, I'm just going to keep moving through, right? So now we're going to come up here to pecs. Hitting pec minor. Pretty broad compressions. Moving the arm. You come down here to biceps. We're going to start, remember we're going to start in a shortened position if it's tender, and then we're going to elongate there, pin and stretch kind of. You can come work the forearms. One hand is full, one hand is not. A little bit of traction, a little bit of traction. You can go up one side and down. typically when I'm working on someone, I'm going to do both legs, and then I'm going to move up and do both arms, and then I'm going to move up and do the head. That's just the flow that I like, but you guys, there's no wrong way to do it. And then we can come up and do some neck and shoulder work. But you can see, still pretty general, still pretty broad. I don't remember, I know we've done these techniques in class, but I don't remember which class was which. Okay, and then you can lay on your side. You guys remember doing side lying? Good side lying, right?
I think so.
Yes.
Would you still consider this your pre-event?
Yeah, you can do all this pre-event. I'm just kind of running through it. When we go through, when we do for pre-event, I would probably, we could just do supine pre-event, right? I'm not gonna do a whole body and then do them side lying and then do them prone. It's just gonna be too long, especially if you're just running athletes through every 10 minutes. It's gonna be like hop on the table, stretch, move, stretch, move, stretch, move. Okay, you're done. Next person, right? So maybe we'll just do supine kind of pre-event stuff, and then we can work on a little more of the going a little more in depth when we go side lying and prone. Prone is the other one. Okay, so from here, I like to start from the head and go down. You can again start the feet if you want. Thinking of shoulders. Movement to the shoulders. And remember, we're working through erectors, through QL, down through here. You guys remember how to do that side line where we wrap our hands around the side of the body and make contact. You okay there?
Mm-hmm.
Make contact with the lateral edge of those muscles, right? We can push erectors down into the spine. When we get to QL, we're going to move a little slower. And remember our hand shape, I'm going to go this way, right? Opposite hand, because this is going to match the shape of the iliac crest. This is going to match the shape of the ribs. So I kind of alternate a little bit. Getting that QL through there. Then you can pull, grab and pull, lift away from the spine. This is pretty general compression. This is going to be like that. The loading that we're talking about here, like I'm kind of doing more bending maybe. Bending through here, compression through here as I'm compressing down into QL like that. We're gonna have the torsion here, like through the erectors, right? We're getting both ends or moving in a different direction. Remember how we work through the glutes, through here, finding that greater trochanter, looking around iliac crest, working that space between the trochanter and the iliac crest, finding the lateral border of the sacrum, looking for, not really looking for adhesions. As we get to, I guess at this point, if we're going to do pre-event supine, then at this point, if you want to settle in and work more of those adhesions and find those trigger points, then that would be good. You know, take a couple deep breaths, pause in your work a little bit through here. Honestly, I don't remember what I've shown you guys and what I haven't. This is good adductor work through here. I think we've done this, right? Getting adductors with our forearms. being aware of what structure you're on. If they have a tendency to roll forward and you're pressing down, you might be more hamstrings. So just being aware of being in the center of those adductors, you might need to roll a little more medial, right, to get the adductors through there. You can also work lower leg in this position to get that medial side pretty well, using pretty broad compressions here. I've got both palms working through here. You can even compress down into the leg. You can hit this one. I might come around the other side and work the lateral side on this leg. But again, pretty broad. If you find something at this point that you want to sit and hang out on and work out, then that's a good time to do it. Being careful here on this IT band. This can be pretty tender, so again, we want to stay pretty broad. But I'm also changing my loading techniques here, right? Where here I'm kind of really just compression. But sometimes you got a lot more space here, and you can even change the direction and get some of that torsion, some of that shearing a little bit into this position here. Okay, I want you to flip onto your stomach, and you would have them do both sides. Okay, now thinking of, we were just at the feet. I'm going to continue working on the feet. Remember, we can squeeze to the calves like this, getting the movement. We wanted to stretch our calf muscles through here. Remember doing this one here, right? Feeling movement there.
You make it look so easy.
She does. I was just thinking that.
I also just taught my class on Saturday. I did this all day Saturday. So
Cannot wait to take one. I just can't wait.
and that's actually, I'm like, what did we do in here? Because I've got different things running through my
Let's
head.
pretend we're on that side.
Yeah. And this is a lot of what I teach in. Okay, we can come in, hit our hamstrings, which we're going to use bigger structures. We don't want to come in with small tools here. You can use a soft fist. And this is where we want to slow down a little bit when we hit hamstrings. We don't want to be, I mean, if you're pre-event, yes, you can come in and move a little faster. But at this point in our massage, we're going to slow down for more post-event or just general sports massage, which I think you might, working in a clinic, you might get more requests for that, like just general sports massage, right? And so it's not really connected with pre-event or post-event or anything. It's just general sports massage, body work type stuff. So unless you have unless you want to go and do events, that's probably more of what you will see in your career anyways. So we start general. I like to go general to specific, right? So you kind of warm up the body. And here it might be easier to work on the lymphatic in this position here. So remember, we have the, I have to refresh all that too. The compression, right? And then we have the venous return. I'm moving these tables every time I work. And then just kind of a more light flushing the area, right, for lymphatic. So make sure you do that. You don't have to do it everywhere, once or twice. Make sure it's in your head. As you work through hamstrings, again, we can go here. We can come broader like this. And remember, if you're not quite sure where the hamstrings are, you can ask your partner to raise your foot off the table a little bit, and that will engage the muscle. Okay, relax. So that way you can tell what's hamstrings and what's adductors, just to kind of map through your head of what structure you're on. You can hit both structures, it's fine. Sometimes I'll come down and compress into the table like this. It does feel a lot different working without lotion though, for sure. Okay, we want to make sure we hit the attachments of our hamstrings, that ischial tuberosity. So I like to do that with a forearm. So coming, sinking down into the table and then pushing up into that ischial tuberosity there. Okay, and then glutes. Following, we just did this one last week, I think. Whoa, fella doesn't have a head. Following this line of the lateral border of the sacrum and the iliac crest. So here, let me show you the side. So lateral border of the sacrum, iliac crest, greater trochanter. Okay, that's kind of the path that I like to take here. And we're going to start broader as we're working on glute max because it's most superficial. Working our way down to glute medius and around the posterior of the greater trochanter. Okay, and then once we've done that, we've kind of warmed up that area, we can sink a little bit deeper. Right, this is where we can come in and get those rotators through here. We're going to compress, move, release, compress, move, release. You can use your hand, you can use a forearm. And I'm again just doing one leg. Sorry, you'll be a little lopsided. Don't forget the sacrum, right? See what's going on through there. We have our good access to the back muscles through here. Sometimes it's easier to go cross body. Sometimes I like to go on the same side. But we can work, get a little, what's it called? Abdominal work. Let's get the obliques a little bit. This is more neuromuscular, I think. But with a lighter pressure, you can kind of get a little bit of glide even on top of the clothes. Pressing. I'm now on the other side of the spine. Pretty broad, open pressure with my palms. Here you can get QL again. If you've got someone that particularly needs the work, just as a refresher for it, we find those lower ribs, right, and iliac crest. So we're going to be here. Oh, sorry. Here, I've got my hands the wrong direction. And you're going to go till just, so you've got the erectors. We're going to palpate and press until you sink a little bit deeper. You should feel the change in the tissue there. Once you hit that, then we're going to change, right? So we're coming till we get to the side of the erectors and we change our direction of direction of pressure, and we go directly in towards the spine instead of down into the body. And remember from the beginning, we're going to start and go up a little bit to get up into this top connection, and then we'll go straight, and then we go down into SI joint for QL. So also while you're working, try to refresh some of those muscles, some of the body parts that we have worked on. Right, we're going to compress. Might have them breathe into it if it's a place of a lot of tension. You press and hold that and let them control the tension with their breathing, right? And you kind of sustain it, and as they breathe in, it should be more pressure there. And then you maintain that pressure as they breathe out. And then I would come in, after you do any specific work like that, come back and kind of flush it and use those broad movements again. Okay, without lotion, we're used to having these nice strokes here. But you can really do a lot of the same things that you do in a regular massage. But instead of gliding, it's just compress, release, right?
Kind of like cat paws.
Mm-hmm. And this does have to slow down your pace a little bit, which is great for when we get to that post-event stuff. Right here, it feels a little more natural for me to do that slower pace, right? Where at the beginning, and I'm on our legs, and I'm like, okay, here we go, here we go. That's gonna feel more like the 110, and here at the end, this is gonna feel more like the 60, like what we were talking about. Okay, and don't forget the triceratops over here. And remember, when you are moving the arm, when you're moving anything really, to be intentional and specific with what you're doing, don't just drop it. I like to grab on the humerus, just proximal to the elbow, give a little traction, put it exactly where I want it. This opens up the rotator cuff here, and you can create the movement, right, with the rotators. You can hit deltoid through here. We don't forget our traps and our supraspinatus up through here. Working triceps. And then back down into forearm and hand. Most of these you can do just like you would do, again, regular massage. Just don't, kind of walk through your routine in your head, modifying as you need to, right? And then we come up and finish with the neck and head. We're going to go for a ride here on this table. Moves so easily. This one may feel different without doing the lotion, but I'm pretty sure we've done all this, right? We can compress into the spine here, up into the occipitals, don't forget that. And here, if you want to slow down and really take your time, finding things that need to be worked on. And remember we talked about getting the loading, the lengthening, right? Where this is a really good place to feel it with your hand in the occipitals and then pressing down and away. I think we may have done that when we did it in class. I think we did it supine. But if we're gonna do it prone, I use my opposite hand, right? And then the hand on the same side of the body to press the traps down and away. And I'm getting a little pull here, but then you can feel those tissues stretching and pulling out from under your hand. And then I would do the other one. And then maybe finish it out walking down the back again. And that's really how I would go through each thing, right? So then you can have.
Which way do you do on the feet for the plantar fasciitis? Like you said,
Oh yes, towards. So the plantar fasciitis is going to pull here, right? And this is this plantar surface when it stretches, right? This is not just plantar, but anything. When you have those adhesions through the muscle and it's pulling, we're pulling on those attachments. So instead of pulling away from the attachments, we're going to push towards the attachments, right? So this direction, we do that with the glutes too. Sometimes we see a lot of trigger points through here. And if you're up on those trigger points, instead of pushing away from the attachments, you're going to come and push towards them. Now, I mean, with feedback, that's not always a hard and fast rule, but usually it feels, you can get a little bit deeper, you can get a little bit more work done pushing towards the attachments. And that gets that release a little bit without as much guarding on their part. So